I'm fried.
It's pretty demoralizing.
We're just seeing numbers like we've never seen before.
It doesn't seem like there's an end in sight.
Healthcare workers are burning out, feeling it more acutely as the Omicron COVID-19 wave is hitting the country.
We're really good at showing up in emergencies and fighting as hard as we can, but there are limits to what any of us can do.
I'm an ICU doctor in Boston. This surge is definitely, in many ways, the worst surge.
And really, it shouldn't surprise anyone that healthcare workers are at their breaking point. They've been on the front lines of the COVID pandemic from the beginning.
Believe me, your doctors and nurses want this to go back to normal. We want life back to normal. Unfortunately, we don't have the luxury of saying, okay, we can go back to normal now, because we're seeing every day what's happening in the hospital.
It's like we've been in this pandemic for 30 years. Feels like it won't end.
Since the start of the pandemic, roughly 1 in 5 health workers have quit. And among those who haven't quit or lost their jobs, 30% have considered leaving.
Our emergency department is hitting its highest numbers that it's ever had in history. We are also drowning with staffing shortages.
It's the combination of so many people coming in sick, again with COVID, so many people already there sick without COVID, and so many fewer nurses. That is really, really crushing us.
More than 500,000 registered nurses are expected to retire by the end of the year. The U.S. Bureau of Labor Statistics expects there to be a need for roughly 1 million new RNs to avoid a nursing shortage. The president of the association that represents U.S. nurses recently sent this letter to the federal government, asking for the shortage to be deemed a national crisis.
It's harder to recruit physicians, it's harder to recruit APPs, it's harder to recruit medical assistants, and it's very hard to recruit nurses.
And the onslaught is impacting all patients, not just those with COVID. Doctors and hospitals are needing to make tough decisions about who to prioritize for care.
When we don't have the beds, when we don't have the staff to take care of you, there's nothing we can do. I can't produce a bed out of thin air. We can't produce people out of thin air. I heard a story of a patient who was in cardiac arrest and needed CPR. There weren't enough people to do CPR. They got a chaplain to come do chest compressions. They were calling people from outside the room to come do chest compressions who were not healthcare workers.
It's a problem that will likely get worse, as doctor staffing levels were low even before the pandemic. Using pre-pandemic data, the Association of American Medical Colleges estimated there would be a shortage of up to 124,000 physicians by 2034. As masks come off nationwide, these doctors say they're bracing for another surge without the people to handle it.
Now, with this pandemic and how people have been treated and how they've experienced their healthcare careers, many of my colleagues I know will be leaving.
I don't think our healthcare system is prepared to take on a fifth wave, but I think it's going to happen.